Have you ever wondered how a medication knows exactly where to go once it enters your body? This question has puzzled many of us, and the answer lies in a fascinating field of study known as pharmacokinetics. Pharmacokinetics, in its simplest form, is the study of what the body does to a drug. It's not just about the drug's journey, but also about how the body interacts with it. From the moment a pill is swallowed or an injection is given, the body begins an intricate dance with the drug, a dance that is choreographed by the principles of pharmacokinetics. The dance is comprised of 4 main stages, often remembered with the acronym ADME. These letters stand for absorption, distribution, metabolism, and excretion. In the first stage, absorption, the drug makes its way from the site of administration into the bloodstream. This could be as simple as a journey down the digestive tract, or as complex as a voyage through layers of skin. Then comes distribution, where the drug, now circulating in the bloodstream, begins to spread throughout the body. It's like a traveler exploring every nook and cranny, seeking out the places it can have the most impact. The third stage, metabolism, is where the body starts to process the drug. It's a bit like a recycling plant, breaking down the complex structures of the drug into simpler forms that the body can use or eliminate. Finally, there's excretion. This is the stage where the body disposes of the drug, usually through urine or feces, but also through sweat and breath. Each of these stages isn't just a step in a process. They're all part of a complex interaction between the drug and the body. They determine how long a drug stays in the system, how potent its effects are, and how it might interact with other substances. Understanding pharmacokinetics allows us to predict how a drug behaves in the body and how the body will react to the drug. It's a field that's crucial to the development and use of medications, and it's one we'll be exploring more in the coming scenes. So, stay tuned. So, a drug has been administered. What happens next? Well, let's dive into the fascinating world of absorption, the first step in our pharmacokinetic journey. Absorption is the process by which a drug makes its way from the site of administration into the body's systemic circulation. And how this happens, you ask? Well, it's all about the route we choose. If we take a drug orally, it must first navigate its way through the stomach and intestines, encountering various enzymes and pH levels along the way. Then, it's absorbed across the gut wall into the bloodstream. Intravenous drugs, on the other hand, are directly introduced into circulation, bypassing this absorption process entirely. But the journey doesn't stop there. The absorption rate is influenced by a multitude of factors. The drug formulation itself plays a key role. For instance, a liquid drug is typically absorbed faster than a tablet, as it doesn't need to dissolve first. Lipid-soluble drugs can easily cross cell membranes, leading to quicker absorption. On the other hand, water-soluble drugs may require transporters to help them across. Patient-related factors can also impact absorption. Age, body weight, and overall health status can all play a part. For instance, an elderly person or someone with a compromised digestive system may absorb drugs more slowly than a healthy young adult. And let's not forget the site of absorption. The body isn't just one big, homogeneous blob after all. Different sites have different absorption capacities. For example, drugs administered sublingually or under the tongue are rapidly absorbed due to the rich blood supply there. But no matter the route or the rate, the end goal of absorption is to get the drug into the bloodstream. Once there, it's like a ticket to ride the body's highway system, ready to be transported to the site of action. However, absorbing the drug is only half the battle. The drug must remain in its active form and reach an adequate concentration to be effective. And that, my friends, depends on bioavailability. It's a term that describes the fraction of an administered drug that actually reaches systemic circulation in its active form. Factors like first-pass metabolism, where the drug is metabolically inactivated before it can reach the site of action, can significantly impact bioavailability. So while absorption sets the stage, the play is far from over. This intricate dance of absorption, with its multitude of influencing factors, is a crucial part of understanding how drugs work in the body. It's a complex process, but it's just the beginning. Once absorbed, the drug is then ready for distribution. And that, dear listeners, is where we'll pick up the story in our next scene. Stay tuned as we journey further into the riveting world of pharmacokinetics. Now that the drug is in the body, how does it reach its target? A question that takes us to the next stage of our pharmacokinetic journey, distribution. Imagine you've just hopped on a train. You're at the station, ready to embark on a journey. The train is your drug and the station is your bloodstream. Now, the train doesn't just randomly wander around the tracks. It has a predetermined route, specific stops it needs to make, and so does your drug. Distribution is the process by which a drug is transported from the bloodstream to the site of action within the body. It's a fascinating process, and it's not as simple as it may seem. You see, for our drug or train to reach its target, it has to navigate through a complex network of blood vessels, tissues, and organs. These are the tracks our train is running on. There are three key players that guide this distribution journey: blood flow, membrane permeability, and binding proteins. First up, blood flow. The rate at which blood circulates through the body can dramatically impact how quickly and efficiently a drug reaches its target site. Think about it. The faster the train, the quicker it gets to its destination. Areas of the body with high blood flow, like the heart, liver, and kidneys, often receive drugs more quickly than areas with lower blood flow. Next, we have membrane permeability. This is all about how easily the drug can pass through the cell membranes. It's like the ticket that allows our train to pass from one station to the next. Some drugs have a golden ticket. They can easily permeate the membranes. Others, well, they might need a little help. And this is where our third player enters the scene: binding proteins. These are the conductors on our train. They can bind to drugs and help transport them throughout the body. But it's not just a free ride. The binding between the drug and the protein can be influenced by several factors, including the drug's chemical structure and the concentration of the drug and protein. Now remember, distribution isn't just about getting the drug to its target. It's also about how much of the drug gets there. This is known as the volume of distribution. The larger the volume, the more diluted the drug becomes in the body. So there you have it. Distribution is the critical journey a drug takes from the bloodstream to its target site. It's a journey that's guided by blood flow, membrane permeability, and binding proteins. It's a journey that's as unique as the drug itself. But the journey doesn't end here. After reaching its target, the drug undergoes metabolism. And that, my friends, is a story for another scene. The drug has reached its target site, but how does it change to have an effect? Now that we've understood absorption and distribution, it's time to dive into the fascinating world of metabolism, the transformation stage in pharmacokinetics. Metabolism is like a magical process where the drug, once it has reached its target site, morphs into a different substance. But what triggers this transformation? The answer lies in the amazing world of enzymes. Enzymes are the masterminds behind this transformation. Acting like tiny chemical factories, they convert the drug into a new substance that can interact with the body's cells, tissues, and organs. This new substance created by enzymes is what we call a metabolite. But where do these enzymes come from? Well, many organs in the body produce enzymes, but the liver is the star of the show when it comes to drug metabolism. The liver is like a bustling city, with enzymes as its workforce, tirelessly working to transform the drug into a form that the body can use. The liver, our body's largest internal organ, has the crucial job of detoxifying and excreting substances, and that includes drugs. Within the liver, there's a family of enzymes known as the cytochrome P450 enzymes, often referred to as CYP enzymes. These CYP enzymes are the main characters in the metabolism story. CYP enzymes work in a series of reactions to change the drug. They might add an oxygen atom here, remove a hydrogen atom there, or even break the drug into smaller parts. This process, known as biotransformation, changes the drug's chemical structure, making it more soluble in water and easier for the body to eliminate. But it's not just about elimination. Sometimes this metabolic transformation can activate a prodrug, a medication that, in its original form, is inactive. The body needs to metabolize it to convert it into its active therapeutic form. Other times, metabolism can inactivate a drug, reducing its therapeutic effect. It's important to note that the rate of metabolism can vary greatly between individuals. Factors like age, genetic makeup, diet, and other medications can influence how quickly or slowly a drug is metabolized. This is why the same dose of the same drug can have different effects on different people. So, there you have it. Metabolism is the stage where the drug undergoes a remarkable transformation, thanks to the tireless work of enzymes, particularly those in the liver. This process not only prepares the drug for excretion, but also influences its therapeutic effect. And with that, we've reached the end of our exploration of drug metabolism. But the journey isn't over yet. Once metabolized, the drug is ready for the final stage, excretion. The drug has done its job, but how does it leave the body? That's where excretion comes in, the final stage of pharmacokinetics. Excretion is the process by which drugs are removed from the body, a vital step in ensuring that our system doesn't become a toxic dumping ground for substances we no longer need. The kidneys play the leading role in this exit strategy. They're like the bouncers of the body, deciding what gets to stay and what needs to leave. Drugs, their metabolites, and other waste products are filtered out of the blood and into the urine, ready to be expelled from the body. But the kidneys aren't working this gig alone. The lungs, too, have a part to play. Remember those gaseous anesthetics used in surgeries? Well, they're exhaled out of the body through the lungs. It's a quick exit, but an essential one. Then we have the liver. While it's primarily known for its role in metabolism, the liver can also excrete drugs into bile, which then travels through the digestive tract and leaves the body the old-fashioned way. It's not the most glamorous route, but it's an effective one. And let's not forget the skin and the sweat glands. Some drugs can be excreted through sweat, making your next workout a potential detox session. So next time you're hitting the treadmill, remember you're not just burning calories. You're also helping your body clear out unwanted substances. Excretion is a complex process, but it's crucial for maintaining balance in our bodies. Without it, drugs could accumulate to harmful levels, leading to toxicity and adverse effects. But thanks to our kidneys, lungs, liver, and even our skin, we're able to clear these substances and keep our systems running smoothly. And that completes the journey of a drug in the body. We've journeyed with a drug through the body. But why is all this important, you may ask? Well, let's paint a clearer picture of the significance of pharmacokinetics. Pharmacokinetics, in its essence, is the study of how our bodies interact with medications. It is the master key that unlocks the understanding of the journey of a drug, from the moment it enters our bodies to its final exit. This journey is not just a simple trip. It involves complex processes of absorption, distribution, metabolism, and excretion, each with its unique characteristics and implications. Now let's delve into why understanding this journey is crucial in medicine. First, it guides drug dosing. Knowing how a drug is absorbed, distributed, metabolized, and excreted helps physicians determine the correct dosage for patients. For example, if a drug is rapidly metabolized and excreted, a higher dosage or more frequent dosing may be necessary to maintain therapeutic levels in the body. Secondly, pharmacokinetics aids in avoiding adverse effects. Every drug has potential side effects, but understanding a drug's kinetics can help us predict and prevent these. If we know a drug accumulates in a certain organ or tissue, we can monitor for signs of toxicity and adjust the dosage accordingly. Lastly, pharmacokinetics is instrumental in predicting drug-drug interactions. If two drugs are metabolized by the same pathway in the body, they could potentially compete, leading to increased levels of one or both drugs. By understanding these interactions, physicians can choose the best combination of medications for a patient, minimizing potential risks. In conclusion, pharmacokinetics is the unsung hero of medical science. It is a complex yet fascinating field that plays a pivotal role in ensuring the safe and effective use of medications. It allows us to understand not just what a drug does to the body, but what the body does to the drug. So next time you take a medicine, remember the incredible journey it takes within your body.